Hi everyone, I'm Jenny from StudyNurseIQ. Today, we're diving into a crucial topic for nursing students and NCLEX preparation: autonomic nervous system drugs. Understanding these medications is essential for your nursing practice as they affect vital body functions and are commonly used in various clinical settings. Let's break down this complex topic into clear, manageable concepts. Let's start with the organization of our nervous system. The nervous system is divided into two main branches: the central nervous system, consisting of the brain and spinal cord, and the peripheral nervous system. Within the peripheral nervous system, we have the autonomic nervous system, which controls our involuntary responses. This system further divides into two crucial components: the sympathetic division, responsible for our fight or flight response, and the parasympathetic division, which manages our rest and digest functions. These two divisions work in fascinating opposition to maintain balance in our body. The sympathetic system prepares us for action, dilating pupils, increasing heart rate, and opening airways. Meanwhile, the parasympathetic system promotes relaxation and digestion, constricting pupils, slowing heart rate, and stimulating digestive processes. Think of it like this: when you're being chased by a bear, your sympathetic system kicks in, but when you're relaxing after a meal, your parasympathetic system dominates. The autonomic nervous system operates automatically, without conscious control. Its main control centers are located in the medulla of the lower brainstem and the hypothalamus. Most organs in our body receive signals from both systems, which we call dual innervation. However, some structures, like the spleen, sweat glands, most blood vessels, and pilorector muscles, only receive sympathetic innervation. This unique arrangement allows for precise control of bodily functions. Communication within the ANS relies on specific neurotransmitters. In the sympathetic system, we have epinephrine, norepinephrine, and dopamine. These are our adrenergic neurotransmitters. The parasympathetic system uses acetylcholine as its primary neurotransmitter. These chemical messengers are released at specific locations and trigger different responses based on the receptors they interact with. Let's focus on adrenergic receptors. Alpha-1 receptors control blood vessel constriction and pupil dilation. Alpha-2 receptors decrease sympathetic outflow from the brain. Beta-1 receptors affect the heart, increasing pulse rate and contractility. Beta-2 receptors dilate airways and relax smooth muscle. Understanding these receptor types is crucial for grasping how different medications work. Now for adrenergic agonist drugs. Alpha-1 agonists like phenylephrine are used to treat hypotension and nasal congestion. Alpha-2 agonists such as clonidine help manage hypertension. Beta-1 agonists like epinephrine are crucial in emergency situations, while beta-2 agonists like albuterol are vital for treating asthma and COPD. Each of these medications requires careful monitoring for side effects and specific nursing considerations. Moving to adrenergic antagonists, or blocking agents. Alpha blockers like doxazosin treat hypertension and prostate problems. Beta blockers are particularly important in cardiovascular care, treating conditions like hypertension, arrhythmias, and angina. Some beta blockers are selective, targeting specific receptors, while others are non-selective. Watch for side effects like bradycardia and bronchospasm. In the cholinergic system, we have medications that either directly or indirectly affect acetylcholine activity. Direct-acting drugs like bethanechol treat urinary retention and gastrointestinal problems. Indirect-acting drugs, including cholinesterase inhibitors, are used to treat conditions like myasthenia gravis and Alzheimer's disease. Cholinergic antagonists like atropine block the effects of acetylcholine. These medications are useful in treating conditions like bradycardia and excessive secretions. When it comes to nicotine effects, understanding both the impact of tobacco use and various nicotine replacement options is essential for patient care. Let's test your knowledge with some NCLEX-style questions. First, which medication would you expect to be prescribed for a patient with asthma? The correct answer is albuterol, a beta-2 agonist. Albuterol works by relaxing the bronchial smooth muscle, which opens the airways and provides relief for patients with asthma. Second, what's the primary side effect to monitor in a patient taking beta blockers? The primary side effect to monitor in a patient taking beta blockers is bradycardia. beta blockers slow the heart rate by blocking beta 1 receptors in the heart, so it's important to watch for a slow pulse. Third question: what is the priority assessment for a patient taking an anticholinergic medication? The priority assessment for a patient taking an anticholinergic medication is monitoring for urinary retention and dry mouth. Anticholinergics block acetylcholine, which can decrease secretions and increase the risk of urinary retention. To summarize our key points, the autonomic nervous system, ANS, has two main divisions with opposing effects: the sympathetic and parasympathetic systems. Medications can either stimulate or block specific receptors in these systems, resulting in different effects and side effects. The major drug classifications are adrenergic agonists and antagonists, and cholinergic agonists and antagonists. Each category has distinct clinical applications and important nursing considerations. Understanding these mechanisms helps us anticipate drug actions and provide safe patient care. Thank you for watching this StudyNurseIQ video on ANS drugs. Don't forget to subscribe to our channel for more nursing education content. Next week, we'll be covering another important topic for your NCLEX preparation. Remember, at StudyNurseIQ, we're making nursing education simple and accessible for everyone. See you in the next video.